Well, good afternoon. That wasn't very good. Good afternoon. Thank you. I want to thank Ted. I do bring greetings from Governor Haslam. He's a great guy to work for, and I'm not just saying that because he's not here. He's in West Tennessee, and I appreciate Ted mentioning our fellow state citizens who are grieving today for the loss of life and the sudden events that occurred there just recently. This is a very exciting place to live, Tennessee is. If you think about our state, 6.495 million people, current census extrapolation. Not a very big state, 2% of the population. I think we're about 17th or 18th in the nation. But we have a pretty incredible impact on the United States and indeed the world. From the birthplace of country music in Bristol, Virginia, Tennessee, to the incredible Nashville country music scene, to Memphis and Delta blues, and the history of rock and roll across our state, and bluegrass, and our cultural impact is pretty tremendous. We have a great place. We have a lot of wonderful place-based assets. We don't have very good health. And that's a significant focus for me and for my department. I'm a physician, and I've been in public health for most of my career. And my present role, when I think about who my patient is, it's not an individual or individuals or even groups of individuals. It's actually about 6.495 million people, plus or minus, who live in our borders or come in and out periodically. You're fairly, immobile right now. I saw some brownies out there. Are those kind of hanging low? So let me ask a question. And let me have you stand up if you've ever walked through the doors of a health department in Tennessee. Stand up if you've ever walked through the doors of a health department in Tennessee. Wow, that's more than I thought in this audience. That's fantastic. Thank you for doing that. I appreciate that. So well more than half. But at least a third of you have never walked through the doors of a health department in Tennessee. We have bricks and mortar in all 95 counties. Well more than 100 locations, and we do a lot of different things, and time does not permit me to tell you all the things that we do. But I want to tell you a little bit about what we do. I want to tell you a little bit about some of the things we're focused on, and as Tokes mentioned, prevention is a really big part of that. I mentioned that we're currently ranked 42nd in the nation for our overall health ranking. That health ranking includes things like cigarette smoking, it includes things like obesity, physical activity, high school graduation rates, violent crime, air pollution, premature hospital admissions, a whole lot of different factors, some of which we have immunization rates, some of which we have direct control over as a department, many of which we do not. But those are the things that really contribute overall to our health as a state. 42nd. We've been a little bit higher. We've been 39th. That's as high as we've been. We've been as low as 49th over the last 20 years. And we are focused on something different. That's my first slide. Cades Cove. We're also an incredibly beautiful state. We have some incredible place-based assets, as you know. So our mission as a department is to protect, promote, and improve, and those are three important words, health and prosperity in Tennessee. And if you look in the dictionary and look at the definition of prosperity, you'll see words like well-being. But what we want to really emphasize, not only for the people that we serve, but for our own population of health workers, and I say health workers, not healthcare workers, health workers, because that link is critical. You don't get health without prosperity, and you don't get prosperity without health. And there's a lot of reasons for that, but you'll have to take my word for it in the short time that I have here. But that is our focus, and we understand how critically important jobs and economic development are to the health and prosperity of our state, and how actually critically important ECD's work is to our state. We're proud to partner with them on the 3-Star Initiative, and for the first time having a health piece of that. Quick story. I'm sitting down with a number of county fathers in one of our counties, and they were talking about the new 3-Star Initiative. This was a good year and a half ago, and one said to the others, why do we have to measure BMI weight in kids in school. What's that to have to do with economic development? And the other guy, I didn't say a word. The other guy said to him, "Come on, if they're overweight, they're not going to be a good workforce. They're going to be more costly workers. It's really important. That's our future. That's the future of economic development in our country." He didn't say it exactly that way, and he had an accent not like mine. But I was like, yeah, somebody's gotten it. So really, really important overall to what we're trying to do. Our vision: we want to be a recognized and trusted leader, partnering and engaging to make Tennessee one of the nation's 10 healthiest states. That's not easy, but it's doable. It's possible. We're already in the top 10 for two things: immunizations and binge drinking. All the rest, we got a ways to go. Now, when I say top 10 for binge drinking, that means we don't do that very much, just to be clear. That's number, we're thinking number 3 right now. That's a good thing. But I'll tell you, one of the places we are, and thank you for standing up, by the way, because last year we were 48th in the United States for sedentary lifestyle, physical inactivity. About 35% of us did not move around very much on a day-to-day basis. This year, a little bit of improvement. We're 45th in the nation. Just under 30% of us are not as active as we need to be. Let me tell you something about physical activity. It's kind of a funny thing, and I don't have time to go into all this, but there's something known in medicine as number needed to treat, NNT, number needed to treat. And when there's an intervention, when a physician like me prescribes something for somebody, they could understand that if I give somebody an aspirin before they've had a heart attack or after they've had a heart attack, or I give somebody tamoxifen to help prevent breast cancer, there's a number needed to treat that would tell me how many people I have to do that for in order to have one positive outcome, save one life for that intervention. Number needed to treat for something like tamoxifen is in the thousands. Number needed to treat for physical activity is 12. Lower, better. We do a lot of things in medicine that have benefit. Now, if you look at tamoxifen, you've got a 50% improvement in your outcomes if you're on it. 2% to 1%. So that's a significant difference. That matters. That's useful to do. But if I, as a primary care doctor, were to tell you in my office that you should have more physical activity in your life, what I just said in the context of a clinical visit between you and I has an NNT of 12. NNT of 12. That means that's a highly effective intervention. Aspirin after a heart attack has an NNT of about 50. So we do a lot of things we can do a lot of things that cost very little that drive tremendous health outcomes. Let me mention one other thing that I don't think a lot of people understand, and that is the health of a population has relatively little to do with healthcare or healthcare access. I mentioned our health ranking, 42. Currently, we're 22nd in the United States for uninsured people. 22nd for uninsured, 42nd for overall health, 45th for inactivity, 47th for smoking, 44th for obesity. So I think I've got obesity, got that number. That's an old number. Don't quote me on the obesity number. But the point is, those things are what's driving health. About 40% of what drives our overall health are behavior. So the governor created the foundation, Governor's Foundation for Health and Wellness, headed by a friend of mine, Rick Johnson, which I'm really appreciative of. They're waking up every day thinking about how to improve that 40% of what drives how healthy you are. By the way, about 10% is healthcare. If you think about our lifespans, about 10% healthcare, 40% behavior, 30% genetics in the developmental environment. Can't do a lot about that at this point, but we're finding out more about the possibility to intervene much earlier. And interventions aren't high-tech interventions. They're better nutrition just prior to conception or during pregnancy, for example. Turns genes on and off, epigenetics. 15% social and economic factors, about 5% environment, the air we breathe, the water we drink, but 40%, the big driver, is that behavioral piece. Healthy foods in the right proportions, physical activity every day, avoidance of tobacco, huge, and safety behaviors. Wearing your seatbelt, bike helmet, motorcycle helmet, those kinds of things that we do that save a lot of lives, particularly young lives with a lot of years of personal life left to live. So mission, vision. We did something in the department several years ago. We actually didn't roll it out until just last January, statewide. So it's a little more than a year old. It's called the Primary Prevention Initiative. It's not funded. When the TennCare disenrollment occurred in 2007, the health department was asked to step up and provide more of a safety net presence for people that no longer had access to TennCare. And we did that. And we currently provide direct care for about 113,000 unduplicated people around the state of Tennessee. And as we speak here today, thousands of people will walk through those doors that about 2/3 of you walk through. And that's really important. And in fact, we serve directly about 1 in 5 Tennesseans every year through a lot of different programs, and indirectly we serve all of us. In the regulation that we do of healthcare and the licensing of healthcare professionals, we're touching on about 10% of Tennessee's gross domestic product of $268 billion, and about 14% of the workforce between people that work in facilities and the licensed healthcare professionals. So significant footprint. But that alone is not driving population health. And the direct care that we're providing, 1 in 5 Tennesseans, is not that 6.495 million people that I talked about. That's a relatively small percentage, and we're not going to move needles by only addressing those numbers. So the Primary Prevention Initiative, very simple, just asking folks, and we didn't make anybody do this, but we said, hey, can you figure out a way to spend about 5% of your time, about 2 afternoons a week, getting outside the walls of the health department and engaging your community in a variety of we have different bundles of activities that will be supportive of primary prevention. Now, I keep saying primary prevention, so let me define my terms. When we talk about primary prevention, we're talking about doing things that prevent disease from occurring in the first place, curing disease before it occurs. So physical activity is a primary prevention, giving an immunization is a primary prevention. Secondary prevention are doing things like getting a mammogram or screening for a disease before it's clinically evident, or tertiary prevention is treating a disease to make sure it doesn't get worse. So focused on health protection projects. At this date, we've got 458 projects going. We've completed 247 in 85 counties. We're rolling this out in a larger part of our department. This is, as I mentioned, an unfunded initiative, but it's really making a difference in communities across our state. And you just see some of the pictures there. And this is one of my favorite primary prevention things. See that little guy? Breastfeeding. Breastfeeding, number needed to treat to prevent for a hypertension prevention benefit in a woman who breastfeeds is 33. More of a benefit than an aspirin after a heart attack, more of a benefit than a cholesterol medication as a preventive measure. Number needed to treat for a woman who's breastfed for a diabetes prevention benefit, 88. There are a host of benefits for mom and baby from that very simple primary prevention. Doesn't cost a lot of money. It has a huge population health benefit. We don't do enough of it in our state, and we're working on that. In fact, we just created a breastfeeding hotline. Here's a plug for 1-855-4BF-MOMS. 1-855-4BF-MOMS, breastfeeding moms. 24/7 hotline. Anybody can call it if they need help with that activity. So this is what I want to get to. Our built environment, and I know I'm preaching to the choir, but I talked about you know, how wonderful a place we live in. And I've had the privilege of being able to travel to all 95 of our counties and having an opportunity to go back to them. And every time I've gone, I've made a point to try and get to the town center. And for most of you, I'm sure you've been to a lot of places in Tennessee. We have some really awesome, county seats, town centers, beautiful main streets. But most of them bow low to the automobile. And no disrespect, but staying in our cars is not the kind of activity that we need. How many folks have had the privilege of traveling around Europe? So quite a few. You know that there's always a city center. Usually there's signs directing you there. I told my kids would ask, why are these town centers so small, and why are they so concentrated? Well, they've got different rules and so forth there. But here's the main reason: as they were developing, they had to build walls around their towns, which means that they had to concentrate their activities, and the streets are narrow, and they weren't worried about moving cars and trucks, mostly worried about wagons. And the big thing is, without walls, people will come kill you and take your stuff. That's not a good thing. But they have this legacy. They have this legacy of these wonderful town centers, and even the ones that aren't pedestrian only, almost all of them are pedestrian limited for some portion of the day. You can bring cars and trucks in there from 4 a.m. to 8 a.m. or 4 a.m. to 9 a.m. and then again from 10 p.m. to 1 a.m. something like that. But for the most part, they're pedestrian zones, and that's something that we in the United States are now just beginning to emulate, just like we've emulated other things like good cheese. So, and this, there are some traditions in Europe. In Italy, they have the promenade in the evening. Everybody kind of comes out. It's a thing. People walk around. They meet and greet. But there's nobody really in this square that's thinking, hey, I'm doing something to protect my health or protect my heart. They're just living their lives. They're just doing normal stuff. There's a built environment that encourages them, that they automatically get engaged with, and doing things that are very healthy for them and their families. So what do we have? Well, how many have been to Market Square, Knoxville? That is a great place. I've been able to walk around there several times. Just like Italy, just off the way, there's a gelato place. It's awesome. Okay, I like gelato. You had brownies, gelato, right? But you look at what goes on there, the feel that the place has. You're drawn to that area. That's where, if you're going to go walking around Knoxville, that's where you want to go. Now you may walk other places, but that's become a destination. You're not driving there to go walk through a door and do something, and then you're going to drive away. You're going there, and you're going to see what you see, or see who you see, or see what you can do in that space. That is great marketing. As clinicians, we have something that I call the arrogant doctor model after a friend of mine, and that is, do this or bad things will happen. Do this or you take this medication or something bad will happen. We want to tell people why it's important to do things, but if you think about what Madison Avenue does, they don't really talk about what won't happen as a result of you not using their thing. They talk about how wonderful your life will be if you're in any way associated with with the product that they're selling. And that's not something we've done a very good job of in health and healthcare over many years. I think we're beginning to understand that that's an important part of our messaging, because we need to be doing things just because they're fun, because we enjoy them, and they need to be the things that make and keep us healthy. Kingsport, Tennessee, I just had a chance to do a walk around there. That is one of their visions for one of their streets. Talk to them a little bit, though, about, hey, there's a part of the, there's a part of the town where you could possibly make the street a pedestrian-only zone for part of the area. Doesn't have a state route going through it. But even just putting, they call this a street, I know you all know this, they call this a road diet. That's that vision picture there. Even just doing that's a big deal, as you know. One of the things that I've seen, and it's just an observation, I don't have real data for this, but one of the things I've seen is when you do things like this, there's initially a lot of resistance. But oftentimes, after the thing occurs, the very people that were most resistant to it say, hey, this is really good. This has been really good for my business. The Non-Smoker Protection Act in restaurants is probably a pretty good example of that for most food service establishments. It's really improved their business. And the final slide really is talking about community trails and destination trails. How many have been involved in some type of a community trail or Rails to Trails project? So keep your hand up for a second. If you encountered no resistance to your project from adjacent landowners. Okay, that's what I thought. But put your hand up again if after that project occurred, some of those same landowners came up to you and said, this is great. My property values have gone up. I love this. Yeah. So we have tremendous assets in Tennessee, and people like me really need your help. We have one final asset, and kind of along the lines of the primary prevention initiative I was mentioning. What we've told our folks is this is what a really successful primary prevention initiative looks like, because across this public health enterprise, and I said we got bricks and mortar in all 95 counties, but there's about 5,400 souls in that public health enterprise in Tennessee. That includes our 6 vital metro partners that don't report directly to me, but they're really important partners here. I think Bill Paul, the director in Nashville, is here somewhere in the audience. But they're really critical. They address the needs, both the care, public health, and prevention needs of 40% of the population, so we really need them. Those are the red counties. But every one of those counties has a health council. Most of them have boards of health as well. Those health councils have a lot of creative community leaders that are really thinking about and concerned about the health of people in their community. But sometimes we say those are also our usual suspects. Those aren't necessarily people in the community that are doing some of the things that you're all doing. Sometimes there's a little bit of crossover with economic development folks and built environment folks, but there's really not enough crossover. And we really need to start encouraging that. We need to start encouraging the kind of the breakdown of those community silos, just like our boss, Governor Haslam, is encouraging the breakdown of departmental silos in state government, so we can have these collaborations and innovate. And when you innovate, you have an opportunity for breakthroughs. And when you have breakthroughs, you have an opportunity to move your needle substantially. And I hope to see the day when people, while they may come to Tennessee because we have an incredible cultural attractiveness, or we have beautiful places to live, we have a fantastic tax and economic development environment, but I know right now they're not coming here because we're a healthy state. And I'd like to see, in a few years' time, people coming to Tennessee and job creators being attracted to Tennessee because we have a healthy, educated workforce that's interested in taking advantage of all the wonderful things our state has to offer. That's what we're going for. Healthy communities really are fun, joyful, together, prosperous. That's what that looks like. It doesn't look like, a stethoscope around your neck. It doesn't look like taking your blood pressure medication. It looks like life. It looks like life. It looks like being around to do the things that you want to do with your family and the people you love. And that's what we're about ultimately in our business, health and prosperity for purpose. Thank you.